Good afternoon, everyone. Welcome to Yashoda Hospital's webinar series. Today we have important topic for you for today's quiz is diabetic management. I am Dr. Amar, AVP Yashoda Hospitals. Hope everyone is super excited for today's quiz. And we are taking every month, last week of Thursday, important topics for the quiz. You can feel free to give your inputs and suggestions, any special topics you want to give us. This quiz has 4 rounds. Each round will have 3 questions. These are time bonded, like every month we are playing. So be quick and fast. I would like to introduce you for today's host for the taking us through this today's quiz. Everybody aware of familiar about Ms. Patusha Chaudhary. She is Asian nursing, and I wish you all the best for all participants from different states and countries. Wish you all the best. Ms. Patusha, please start. Please.
Thank you, sir. A very good afternoon to everyone, those who have already joined the game, and let me read the names of you who have joined. Sia, Pravinika, Gautami, Sabha, Mr. S.K., Kami, Dinesh, Monica, Buji, Mahi, Amravati, Sirisha. So many are still joining. So before this, let's start the game, and I'm going to give you a few of the secrets that you can go ahead. So this is welcome to the 4th Nursing Pro quiz on diabetes management that we are going to go ahead for today. So let us welcome all of the pro participants for today's quiz. And let me tell you the secrets to win the game. So whenever you want to win a game, you need to understand like what are the secrets, right? So these are the pro secrets that I'm going to give you before starting the quiz. So here, please try to eliminate the wrong answers first so that you can select the right option, and then check for the multi-selects and double points, because all of the in all the rounds, the third question consists of the double points. So make sure you will have this double points. And most vital, the fastest finger first. So it is not about how many answers you are trying to get it right, but still about getting it right also with the fastest finger first within the time frame. So the first round will have 3 questions, means all the rounds will have 3 questions, which will have a time limit. Check for the time limit, which I'm going to give you brief in each round. So let us start the game. I think now you're going to use all the secrets. How many rounds? Like 4 rounds we have. Round 1 describes about the diabetes and its causes. Round 2 asks you about the diabetic ketoacidosis signs and symptoms. Round 3 about nursing management of DKA, and round 4 is about DKA and patients education. So I think all of you are excited to start the game. Round 1, the first question is about to come. Fastest finger first again. Okay, here is your first question. The risk factors for type 1 diabetes include all of the following except. So option A, diet. Option B, genetic. Option C, autoimmune. Option D, environmental. I'll read the question for you. The risk factors for type 1 diabetes includes all of the following except. So which of these 4 options do you think the best? So 49 people have answered, 50, 51, it's going on. So options are 4 again. A is diet, option B is genetic, option C is autoimmune, option D is environmental. So we can see like 60 people have answered it. So we have got just 15 seconds to answer this question again. It is asking about the risk factors for type 1 diabetes includes which all, but except. Don't select the options which are right, select which are the options which are wrong. So the time is up. And only 10 have just answered it correctly, that is diet, and the rest all have answered. Most of you people have answered it is environmental. How does this cause diabetes from the environment? Okay, let us see the scoreboard. Pavi is on the top, Ganesh is on the 2nd, Sirisha on 3rd, Gayatri is on 4th, and Lee is on the 5th. So let us go for the rationale behind this. Yes. So option A is the right answer. Type 1 diabetes is primarily failure of pancreatic beta cells to produce insulin. Primarily affects children and young adults and is unrelated to the diet. So the option is except. It's not about which is included, right? So here is your second question. Ready for that? Diabetic patients are at increased risk of heart disease if they also do. I'll read the question again. Diabetic patients are at increased risk of heart disease if they also do what? Option A, consume a high fiber diet. Option B, have high HDL, high density lipoproteins, cholesterol levels. And then option C is take aspirin. Option D is smoke. Which of these options will say that there is a risk for increased heart diseases in a patient, those who are with diabetes? So those who are watching it on the Facebook can also answer it, your options in the comment section so that we can also see that. 67 have answered it correctly, not correctly. 69 people, 70 going ahead. So you have just got 5 seconds to answer this question again. Yes, the time is up. So let us see who have rightly answered. Only 26 have answered. I know everybody will go ahead with only B because stating about the cholesterols. No, never just direct with heart disease and cholesterol. It is not relating with that, but still you have to also check with the main things, right? So, oh my God, Pavi went left somewhere. Amravati Jyoti is on the top. Anusha is on the second. Pavi again on the third. Ani and Ganesh on the fourth and fifth. So let us see what is the rationale. Option D is the answer, that is smoke. People who smoke are at greater risk of developing heart disease because both diabetes and smoking narrows the blood vessels, right? So don't go just for the option. Let us go for the last question, which will also have the double points. Fastest finger first again, right? So here is your double points. The question is, excessive thirst and a volume of very dilute urine may be the symptom of what? Excessive thirst and a volume of very dilute urine may be the symptom of what? Option A, urinary tract infection. Option B, diabetes insipidus. Option C, viral gastroenteritis. Option D, hypoglycemia. So which of these options states that the person with excessive thirst and a volume of very dilute urine will be the symptoms? So don't go wrong in just selecting with the dilute urine, but think what might be the correct answer. It's not just only about the fastest finger first, but still you have to also select the right answer to be on the top score. Yes, you just got 5 seconds to answer this question. Come on, come on. 79 have already answered. Yes, time is up. Let us see how many of you have rightly answered it. So 57 have rightly answered it about the diabetes insipidus. Rest all went wrong. So let us see the scoreboards. Who is on the top again? Amravati is on the top. Anusha is again having the second position. Annie, Rahman and Pravinika is on the third, fourth and fifth positions. Congratulations. So here is the rationale behind this. So answer is B, diabetes insipidus, because it is a condition in which the kidneys are unable to conserve the water, often because there is insufficient antidiuretic hormone, that is ADH, or the kidneys are unable to respond to the ADH. So this is why the answer is diabetes insipidus. Come on. So we have done. Congratulations to all the first round winners with the top 5. So let us see the round 2. It's asking you about the diabetic ketoacidosis and what are the main signs and symptoms. So again, think and answer. So here is your first question about the true or false. You'll have 30 seconds to answer this question. Oliguria is a sign of diabetic ketoacidosis. Is it true or false? Do you think oliguria is a sign of diabetic ketoacidosis? Is it yes or no? True or false? 68, 78, almost most of the people are answering. Yes, 82 people have answered. Just got 5 seconds to answer this question. You can also answer this in the chat section, whatever the answers are. Great. Only 28 have answered it correctly. So yes, let us see for the rationale before that scoreboards. The scoreboard, Pravanik is on the top, Rahman is on the second, Amravati Jyoti have from first to third, again Suni and Sirisha. Congratulations, but still faster pace, okay? So let us see what is the rationale behind this. The answer is false. Oliguria is defined as urinary output less than 400 ml per day or less than 20 ml per hour, and is one of the earliest signs of impaired renal function. It's not decay. So positive ketones in the urine, polydipsia, and abdominal pain are the signs and symptoms of diabetic ketoacidosis. So the option is false. Come on. Again, the fastest finger first. The second question in the round 2. DK patient is on insulin infusion and his GRBS is 300 mg per dl. And he also has 5% dextrose and 0.45% normal saline. Which symptom is most concerned? Option A, patient complains of thirst. Option B, patient has a potassium level of 2.3 mg per dl. Option C, patient's skin and mucous membrane are dry. Option D is patient has nausea. So you've just got 3 seconds to answer this question. Most of you are answering faster. Yes. Only 33 have answered it correctly. That is, patient has a potassium level of 2.3 mg per dl. So let me show you the scoreboards, then I'll discuss the rationale. Pravinika again on the top, Amravati Jyoti second, Jagan is on the third, Sirisha and Pavi on the fourth and fifth. Patient has a potassium level of 2.3 mg per dl as the right answer. So whenever you're trying to give the IV fluids and insulin used to treat the DKA, can cause the potassium levels to drop too low. So a low potassium level can affect the heart muscles and nerves. So that is why it is required for us to frequently watch or monitor the potassium every second hour. So that's why you have to remember this potassium when you are trying to give the insulin infusions. So last question, but you will have double points with this. Just fastest finger first again. Which of the following statements is incorrect about diabetic ketoacidosis? Read the statements again. So option A, extremely hyperglycemia more than 600 mg per dl. Option B, ketones are present in the urine. Option C, metabolic acidosis is present with small breathing. And option D, potassium should be at least 3.3 during treatment of diabetic ketoacidosis with insulin therapy. 1-on-1 answers, great. So who went wrong? Most of you went wrong. So extreme hyperglycemia as the right option. Let us see, because we have asked you about the incorrect, right? Incorrect about DK. It's not about which is correct. So the scoreboard, Pravinika is again on the top, Annie second, Gani, Rahman, and Ras is on the fourth and fifth. Congratulations. Let me tell you the rationale behind this. Extreme hyperglycemia is nothing but more than 600 mg per dl. Blood sugar, which is about 250 mg per dl, is always a contributing factor for DKA. But a blood glucose level higher than 600 mg per dl is called a hyperosmolar hyperglycemic diabetic syndrome. So which will not come under the DKA. So remember this option. So we are done with the second round. Going ahead with the third round. It is about nursing management for a patient with DKA. Let us see what is there in the first question. The first question, and it is multi-select, select 2 or 3 or options, whatever you have. So a nurse is preparing a care plan for a hyperglycemia patient. The priority nursing diagnosis would be what? So you can multi-select 2 options, you can do this. So option A is asking about high risk for fluid volume deficit. Option B, lack of knowledge about disease and treatment. Option C, imbalanced nutrition. Option D, coping up strategies. So what do you think that is the best option among these statements? You have to multi-select and your time is up. Very few answers. Very few answers. Okay. So 65 people have answered for A and also multi-select. Because this is a multi-select, so you have options 2 are correct, A and D. So let me see the scoreboard first. Pravidika again on the top, Annie in the second, Sirisha, Gani, and Rahman on the next place. So let me show you the answers A and D. Glucose and the body is accompanied by fluids and electrolytes. That's why it causes the osmotic diuresis, which is leading to the dehydration. So the fluid loss must be replaced as a priority basis when it is becoming severe. So that's why the options are A and D. And also we have to influence that the patient should have some kind of empathy, that is coping mechanisms. So last question, which you will, last before the question. So here the question is asking you about the rotation sites for subcutaneous insulin injection, which should be practiced, and the site should be used only for every what? Option A, third day. Option B, every day. Option C, 1 to 2 weeks. Option D, 2 to 4 weeks. How frequently you can change or rotate the insulin injection sites? What would be your best answer? So 104 or 105 or 106? Yes, almost 81 people have answered it correctly. That is every day. Come on. Pravenika is again on the top, Annie on the second. Sorry. So the option is B, that is every day. According to the guidelines, so injection at the same spots repeatedly can cause the inflammation or the fat tissue increases. So this condition is called lipohypertrophy, thus improving the predictability of insulin absorption and the action. So that's why the option is B. So keep rotating the rotating this according to the picture which is shown. But at least recommended is at least 2 centimeters away from this zone which we have given on the prior to that. So last question, but you will have the double points here. The question is asking you about which insulin can be administered through continuous intravenous infusion. So it is about insulin intravenous infusion. So the options are option A, insulin, that is Lantus. Option B, insulin, that is Novolog. Option C, insulin, that is Glargine. And option D is insulin Novolin R. Don't confuse. You have just got 5 seconds to answer this question. Make sure you will select the right option. 90, 106, 109, 110 people have answered this question. Oh, most of the people have answered it correctly. Is it? No, 25 people. Okay, let us see the scoreboard. Oh God, Pravenika have went for from the first to third, Annie on the second, the rest on the second, Mahi and Sirisha on fourth and fifth. Let me tell you the rationale. So Novolin R is nothing but the regular insulins or short-acting insulins that are given intravenously as a continuous infusion. Rest all we will never give. So only the regular and short-acting insulins we will try to give through intravenous infusions. Great. Finally, we have come for the fourth round. So make sure, again, the fastest finger first. We doesn't know. People who are jumping into fifth and fourth and third and second are trying to go up and down. So make sure you will protect your position. So round 4, again, all the best. DKA, it is about the patient education, what we can give. Select the best options among us. The first question is asking you about the nurse is teaching about preventing DKA at home. What statement is the best demonstrates that the patient understood? You taught the patient about DKA at home, how they have to take care, and the patient, you need to re-demonstrate. They need to get the re-demonstration. Option A, I should not be alarmed if ketones are present in the urine. Option B, it is normal if my blood sugar is 250 to 350 mg per dl while I'm sick. Option C, I will hold off on my insulin. Option D, I check my blood glucose levels every 4 hours when I'm sick and consume liquids. So most of you have answered it because it's little higher in pace with the statements. Still you have answered. 65 people have answered it correctly. Congratulations. So let us see the scoreboard. Again, Annie is on the top, rest is on the second, Pravenika, Mahi, and Sirisha is on the fourth and fifth. Option D is the right answer. Post-discharge, the blood glucose level should be in the normal range, below 250 mg per dl, and the hydration should also be adequate for a DK patient. So that's why the answer is this. So second question, which will have the multi-select, you have to select 2 options in this. What are 2 vital factors nurse is expecting from the family members while teaching on diabetes? So what are the 2 vital factors? You have to select 2 vital factors which the nurse is expecting from the family members. It is not from the nurse, it is from the family members, okay? So option A is assess the readiness of patient's family for a diabetic teaching plan. Option B is dietary and lifestyle changes. Option C, proper self-care, especially food care. Option D is about administration and management of insulin. Come on, you doesn't have much time. 63 people have answered it correctly. Okay, so 75 people have answered it. And option A has been selected only by 22 people. Let me show you the scoreboard. So this changes the game actually. So Annie is on the first, Russ is on the second, and Pravinika again is on the third top. Amravati Jyoti, Sirisha is again scoring with the fourth and fifth positions. So let me tell you the rationale behind this. A and D options are correct options. Family members helping in managing lifestyle is really important because you cannot just go always teach the patient. So family members needs to modify the lifestyle. Then normal blood sugars also needs to be managed from the family members at home. These are the two important factors which the nurse is expecting that the family members will definitely tell in the patient's education, right? Congratulations. And the last question, which will again have the double points, and this is the last question and whole of this quiz. So the question is asking you about a hyperglycemia patient demonstrates acute anxiety when first admitted in the hospital with diabetes mellitus, and the nurse should decrease anxiety by doing what? Option A, administer sedatives. Option B, make sure that the patient knows all the information. Option C, ignore the signs and symptoms of anxiety. Option D, convey empathy, trust, and respect towards the patient. So what would be the best option that you want to select to eliminate the anxiety? 122 answers have been done. So most of the people have answered it correctly, 67. So answer is convey empathy, trust, and respect, as most of you have answered it. Responding with empathy within the scenario is really, really important, and respecting the patient needs to decrease the anxiety. So whenever you start being into the other shoes and being so empathetic and being so trustworthy makes the patient so comfortable so that they will definitely get the elimination of anxiety. So that is the right option. So before me showing you the scores, let me tell you one important thing. Congratulations to all the winners. So there is a small announcement for all of you. Join us every Thursday on Facebook Live at 3 p.m. for more and more exciting webinars and quizzes. Every month at the end of the week, means every month end, we are trying to conduct these quizzes. Make sure that you will also join the quiz. Also the webinars every Thursday, which are most interesting topics. If you wanted to make it more exciting, then take a selfie with your quiz group, those who have also participated along with you, and make sure that you will add us with the hashtag Yashoda Hospitals and keep it more exciting on the social media. So congratulations to all the winners. Before me showing you the top winners, I want to also thank Dr. Amar sir and also our VP Nursing, Shanti Madam, for preparing this wonderful quiz and getting it before you. Thank you so much. And here are the top 3, also top 5, I'll tell you. Top 3 is Annie, and top 2 is Sirisha. Who's top 1? Come on, come on, come on. Amravati Jyoti is on the top 1. Yes, congratulations, Amravati, Sirisha, and Annie. And 4th and 5th is Rahman and Res. Congratulations, all of you 5. So this is so exciting. Thank you so much. Please join us and stay tuned to Yashoda Hospitals. Over to you, Amar sir.
Okay. Well played, Patricia. And all the participants are very active and they are taking out answers. Most of them are correctly answering. And every Thursday, as Patricia said, end of the month, we are doing this kind of things. Please feel free to give your inputs, what kind of topics you want for the quiz and any suggestions. So thank you. And congratulations for the winners, 1st, 2nd, and 3rd prize. So be logging with us on the Facebook and webinars. Thank you.
Thank you, everyone.